G-Roll Electronic Productions, baby.
Welcome to DEMOCREPUBLIX, where we cover the real news that matter to we the people. CDC justified new mask guidance based on vaccine study listed as failing peer review. Now this is from Just the News. Basically, the whole mask guidance was based on a study that didn't pass the peer review, and as someone who's I've published a couple studies that's peer reviewed, so I know the process. They look when you submit studies, people in your field look at the studies, look at the study, and they verify. Just make sure that everything you say in here is backed by data and the information that you collect and stuff. So that's what they mean by peer reviewed. And all major journals have a review team that goes over the studies, and the CDC used one of these studies. I guess they just picked one that actually showed that, about masks, and they're basically saying that they work. So this is from Just the News. The article says the Center for Disease Control and Prevention cited an unpublished study from India to justify its recommendation Tuesday that fully vaccinated people wear a mask in public indoor settings in areas of substantial or high transmission of COVID-19. That study, which claimed that the Delta variant produced an unusual large viral load in more than 100 vaccinated healthcare workers with breakthrough infections, was listed as having failed peer review in the journal Nature when the CDC cited it. So, again, how the process works. You have a study, and you submit the study to a journal, and the journal have a team that looks at it to confirm the data that's in it. And the one that the CDC used to say, "Hey, we need to bring the mask back," it failed the peer review. Archives of the study page on Research Square, a preprint server for unpublished research, showed that it was marked reject on July 9th and remained so at least through the evening of July 26th Eastern Daylight Time. So I don't know if it's still rejected today. That version was still live early Wednesday morning, the day after the CDC cited the study in the July 27th updated science brief, according to a Twitter user who posted a screenshot. The reject status and review notes were removed by mid-morning and replaced with posted, suggesting Nature had approved the paper without revisions, which drew controversy on Twitter. The notes were quickly restored and the status changed to revised, bearing the same date, July 9th, as the original reject status. And here's a picture of it right here. And this is in Nature, and it's been rejected. Research Square addressed the confusion twice around noon Wednesday, blaming a bug. Yeah, right. They probably got pressured, but then when people called them out on them changing it, they changed it back. And a user interface error on our end. It said the paper was still under review and the current editorial decision is revised. The review notes disappeared again from the peer review timeline later in the afternoon, leaving only a current status classification of the paper as under review. Research Square also posted a revised header clarifying that the paper was being considered by a Nature portfolio journal, not necessarily the flagship journal, and that is partners with the publisher on a journal integrated preprint deposition service. This whole thing sounds funny. The representations of Research Square would mean the CDC cited deficient research, backed its findings that emerging data suggests COVID vaccines have lower effectiveness against confirmed infection and symptomatic disease caused by the Delta variant, which is now predominant in the United States. CDC Director Rochelle Walensky said fully vaccinated people, quote, have just as much viral load as the unvaccinated, making it possible for them to spread the virus to others, which is why all children should wear masks in public schools. NBC News reported, and we reported that also. The White House announced it would start requiring masks in its buildings Wednesday. Texas Republican Rep. Dan Crenshaw was among those calling out the CDC for the quality of research informing its policy decisions. I do better research than the CDC, it seems like. It seems like I do better research on this stuff because they just get it all wrong on every single instance, it seems. The game changer data the CDC used for the mask mandate is from a single study from India, he tweeted. The study was rejected in peer review, but the CDC used it anyway. Of course, they used it because it furthered their goal of what they want to do, which is shut down the country again. So they'll pick and choose what studies they use. And of course, the one study that went their way was actually rejected, but they used it anyway. The article goes on to say that Just the News contacted the CDC Nature Research Square and the study's authors to gain clarity of the chronology of the changes, the accuracy of the review notes, and the timing of the conversations among the U.S. agency. London-based publisher and research in the UK and India, none responded. The research team submitted the paper to Nature June 18th, and it was assigned an editor and distributed for peer review the same day, according to the original peer review timeline on Research Square. The 4 reviewers turned in their assessments between June 20th and July 8th, the day after the last came in. The editorial decision purportedly arrived from Nature, reject after peer review. And I have to tell you, these people that look at these studies take it seriously because journals, they're rated. They're rated online. I can't remember the rating system. It's been a few years since I published, so it's kind of hard for me to remember the point system. But it's a point system for each journal, and you can look at the point system so you can know how. And so they take the review process very seriously because they're rated on it. So if this study that the CDC used was rejected. But the preprint study was already making waves before reviews was finished. See, that's the problem right there. They looked at the preprint instead of waiting for it to be reviewed. Science News reported July 2nd that, quote, antibodies from both recovered and vaccinated people were less potent at stopping Delta from infecting cells than Alpha or the original version of the virus from Wuhan, China. The Indian healthcare workers have been given an AstraZeneca vaccine, which was not approved for for use in the U.S. So, and here's some screenshots of the article here. But yeah, let me know what y'all think about this. This is really interesting how the CDC used research that failed peer review to go back to telling people they need to wear masks. So and also I got new T-shirts out. It's I Will Not Comply T-shirts. Description. The link is in the description if y'all want to check out the new shirts. And go to DEMOCREPUBLIX.com for the latest in news. Share this out and don't forget to like. Until next time.